Hello and welcome back to What Your Blood Tests Really Mean. Today we're going to be talking about HbA1c. Most people know it as the blood test for diabetes, and that's absolutely true. It is one of the best markers we have for looking at your average blood sugar over the last 2 to 3 months. But here's the thing. One of the biggest mistakes I see is assuming that the lower your HbA1c, the healthier you are. And that's simply not always the case. I'll tell you about a patient who came to see me because she was exhausted. So she says to me, I've become increasingly anxious. I'm having these energy crashes. She was feeling shaky and a lot of irritability, difficulty with concentration. And she's saying to me, I'm really just so anxious and irritable all day. Anyway, her blood tests had all come back normal, including her HbA1c, which in fact wasn't just normal, it was low. And again, most people would look at that and think, brilliant, your blood sugar must be excellent. But when you listen to her story, it just doesn't fit. And because blood tests should never be interpreted without looking at the person sitting in front of you. Before going any further, I want to be really clear. Low HbA1c doesn't automatically mean there's a problem. Some people have naturally low blood sugars and are perfectly healthy. In fact, elite athletes can have lower HbA1c, and people following low carbohydrate diets often do too. But when someone has symptoms like energy crashes and shakiness, irritability, I start asking different questions because it sounds like this person may be struggling to keep their blood sugar levels stable, and potentially they're dipping too low, blood sugar levels are dipping too low between meals. So the questions are, is your liver storing enough glycogen? Are stress hormones like cortisol and adrenaline having to step in just to keep your blood sugar levels up? Because if that's happening, the HbA1c is only telling me part of the story. And this is often where I recommend something like a continuous glucose monitor. Because remember, HbA1c gives us an average. And averages can be incredibly misleading. Think about it. So if I told you the average temperature in Edinburgh today was 20 degrees, which it is, that doesn't tell you that it was 12 degrees first thing in the morning and maybe going up to 26 later in the day. So the average hides the swings. And blood sugar is exactly the same because somebody can have a completely normal HbA1c while experiencing huge peaks and crashes throughout the day. Or they can have a low HbA1c because they're spending too much time running low. The average doesn't tell you that. And here's something else that many people don't realize. HbA1c in the blood can also be influenced by things completely unrelated to blood sugar. So iron deficiency, vitamin B12 deficiency, certain types of anemia, and changes in your red cell lifespan, because what we are measuring is how much sugar is being attached to those red cells. Even some medical conditions can make the HbA1c appear higher or lower than it really is. So once again, I don't look at HbA1c in isolation. I'm looking at the symptoms. Diet, your fasting glucose, your fasting insulin levels, C-peptide, liver health, the full blood count. And sometimes a glucose monitor can be really, really helpful because every one of those pieces helps me understand what's really going on. And that's the beauty of functional medicine. We're not just asking, is this blood marker normal? We're asking, does this blood test make sense for the person sitting in front of me? Because again, every blood test leaves clues, and sometimes the most interesting clue is the one everyone else thought was reassuring. But next time, we'll look at another marker that often gets overlooked, vitamin B12, because normal B12 and optimal B12 are often two very different things.